Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm here at the AHIMA 2023 conference on the main stage because I'm about to sit down with AHIMA President Jennifer Mueller. She and I are going to talk about how far the health information management profession has come over the years. And we're going to talk about some of the technology and policy trends that she's seeing that now the health information profession is facing. We're also going to get a chance to talk a little bit about where she sees the future of health information. I'm excited for this interview, and I hope you enjoy it. Well, Jennifer, welcome to the program.
Thank you so much for having me.
Yes, it's exciting. I'm so
It is
excited to sit
exciting.
down with you on the AHIMA 23
I know.
stage.
This is great. It's become my second home.
It has. First of all, thank you so much for the opportunity to be the MC here at AHIMA 23. It's
You've
been a lot
great.
of fun.
You've really been great.
Well, thank
Funny
you.
and just really articulate. Great.
And by the way, I have to compliment you. Love your hairstyle.
I know, right? We're like
People
twinning.
have been telling me that, like, did you and Jennifer coordinate? I'm like,
Yes, right.
yes,
We
yes,
did.
we did.
We did, yes. I love it.
Well, I'm excited to sit down with you and talk to you a little bit about sort of the history of where we come and then where we're going in terms of HIM and HIM professionals.
Yes.
I think you have a very unique perspective on that, given your position here at AHIMA.
Yes.
So let me start by asking this question. You know, we've come a very long way from the days of dictaphone and linear and all the transcribing services to now where, you know, HIM is such a broad profession covering a lot of different challenges, a lot of different areas. Can you give a comment on that progression and what do you see when you look back over the years of it?
Yeah, well, I'm old, so I've been around. I've lived all of that. It was actually something I was talking about earlier, that when I started my career in health information, I worked in the medical records department. We had a wall full of paper records, 14 volunteers in the department that would file papers. And we just purchased our electronic health record system. And my job basically became working on the team that implemented the electronic health record. And I would say within about 10 years, we had no more paper records in the department. So right away, it just shows you how quickly, I mean, 10 years is long, but it's also fast, I think, for, you know, to go completely paperless like that. But now we're now collecting so much data. It's not so much, you know, chasing after documents and things in the record, but it's making sure that the data that is going in from our clinicians and others, that it is accurate, complete, timely, you know, so that we can use it. And so that's what I see as super exciting, because we should do something with that data. You know, we have so much of it. Maybe, you know, what do they always say? Lots of data, not enough information, kind of thing.
Right.
So how can we help take that data and do things with it to improve patient care?
Yeah, it sounds like, you know, we've moved from, I'll call it a mechanical function of retrieving, storing records, physical records, to something that a lot more, you know, cerebral, if you will, where you're looking at the use of that information, how it's collected, why it's collected, and then how to actually leverage it. We've heard a lot of talk here around leveraging the data for more useful things.
Yes, yes, and I do want to still give credit to, you know, the professionals that still work with the electronic health records and their jobs of making sure that those records are complete and accurate. The professionals that code the data to get it out the door for billing and all of that. All of those things are still so very, very important in our profession. There are just now additional opportunities for health information professionals to be more on the data side of things, data analytics, data science.
And as you look back, other than the electronic health record, have there been other external forces or internal forces that have really changed the profession and changed the nature of what you do?
Yes. I would say regulatory. There has been, I can't specifically, you know, list them all, but I recently saw a timeline that went back quite a ways to maybe in the 2009, 2010-ish timeframe, when we had a few regulations that were coming out, meaningful use, you know, trying to encourage adoption of health IT, and then to now where there are so many regulations that are out there that have to do with data privacy, interoperability, information block.
Right.
I mean, there's the list
You
goes
can
on and
go
on.
on,
Right.
right? Absolutely.
Yes.
Absolutely. So we've talked a little bit about the past. Let's talk about the present. What are you seeing right now as some trends that you're keeping your eye on from the industry?
Okay, well, there's a couple. The one that I'm most passionate about is interoperability, because I really want to see the day when we can literally have information shared so that it is available to clinicians when they need it, when the patient needs it. I've often told the story of my dad, who has a lot of, he's an older adult, he has lots of chronic illnesses, and he has lots of doctors, and they currently, he carries that paper around with him, and it's just not something a 76-year-old guy should be doing. But yes, so definitely the TEFCA, the Trusted Exchange Common Agreement, Trusted Exchange Framework and Common Agreement, that all that's going on with that is fascinating, and I'm excited to see kind of where that all goes. Another one is AI. It's been 20 minutes, so I mean, we have to say AI. But we have workforce issues in healthcare. I mean, there's probably workforce issues in every industry, but specifically in healthcare, I've heard just that's like number one on CEOs' minds. And so we kind of have to figure out what we're going to do. And I think leveraging technology and specifically AI, of course, under the right guidance, definitely keeping in mind privacy and security and all of those guardrails. But that technology, it really has a lot of hope to, some of it's already kind of out there, with ambient listening and exam rooms creating the clinical note, AI creating clinical summaries for providers, the patient portal messages that the AI is crafting the note. And actually, I heard a funny story too that I can't remember where I saw it, but it was when a clinician responds to a portal message, it's just sort of direct and to the point. But when the AI responds, it's a more empathetic.
Yes, I've heard that same comment. Isn't that funny,
It
right?
is funny.
That AI is actually humanizing the responses.
It is. It is. It was really funny. So those are a couple things that I think. I mean, I know we have a long way to go with really. Like I mentioned, those guardrails around AI, because of course, if taken in the wrong context, it could be bad. But there's just so much opportunity, even patient-facing, with inpatient portals, helping patients understand their bill, helping patients with, their just understanding the chatbots is what I'm trying to say. Yeah.
Yes, yeah, how they can help them navigate, how they can answer questions without having to pick up the phone and dial into that call center, right?
Yes, right.
Is there a technology other than AI that's exciting you, or that you're kind of keeping your eye on?
Well, I know that a lot of organizations have implemented electronic prior authorization processes. I mean, that was something even at the hospital I worked at prior to my current job, we implemented. And I know for sure they have seen savings in terms of just time and resources that it takes to manually do all the prior authorization work. So that's a really exciting one. And if we can do more of that. I mean, I heard people talking about how great it would be if we could automate the denial response letters, so when a insurer denies a claim, that takes so much time. And if we could just automate some of those things using this technology, it would be great.
And as you look forward, what are some of the things that you hope that the AHIMA organization, but also just HIM professionals in general, should be doing to ensure their future is bright?
Well, there is a lot to keep up on. I know that. I know that AHIMA does a great job with sending us lots of information, and it does take a lot of time, but I encourage people just to stay up on what's going on in the industry, because there is so much and there are so many opportunities as a result. They should stay up on the Data for Better Health initiative that we just announced this week, because that's going to be a great place for health information professionals to really elevate the work that they do in their organizations. You know, AHIMA is helping bring light to the importance of collecting, using, and sharing that information. And I think health information professionals can be leaders in their organization in those initiatives. So some of those kinds of things, networking, volunteering, saying yes. I mean, all of those things that I always say, because that is really, I think, what makes a person a better professional. And just knowledge is, I mean, knowledge is power. I mean, that is so commonly said, but it's true.
What's next for you? I mean, you're coming to the end of your term here. What's next for you?
Well, I'll still be past president next year, and so I'll still. We have a lot to do at AHIMA. You know, we'll have a new CEO. We have the acquisition of HC Pro, the Data for Better Health initiative. There's our strategic plan will be. So there's still so much to do, and it's so fun. And I'm really proud of AHIMA. I'm proud to be a member of AHIMA and a health information professional. Our future is bright. It really is.
Now, on that note, just one of the questions I've been asking folks while I've been here at AHIMA 23, what would you say to somebody who's maybe thinking about maybe coming into the health industry, maybe becoming a health information professional? What would you say to them to say, you should come here, you should join and become part of our industry?
Well, I would tell them that they should become a health information professional because there is so much opportunity. Like many of us started in the hospital setting, not all, but many. And I just think now people can work in a hospital setting. They can work at a payer. They can work for a vendor. They can work on the data side. They can work on the technology side. I mean, that's kind of the cool thing. Even clinicians, I even sometimes lump clinician into health information professionals, because we have nurses that are clinical documentation improvement specialists. We have physicians that are chief medical information officers. You know, so there are just like so many different things that we can do. I mean, data's everywhere, and I think it's just up to us, or people like us, to help bring that together and get that data in a way that we can really improve patient health, patient populations, reduce inequities that are out there. And it's a great profession. I stumbled upon it myself. So I thought I was going to be a pharmacist.
Well, and you know, having listened to you, I mean, I'd be convinced. I mean, this is, I mean, it is such a wonderful industry to be part of. There's so many different aspects, now, especially now with data.
Yeah.
You can dive into very deep and get into super data analytics.
Yes.
Also, you can go very high level and just kind of make use of all the data
Yeah.
for, you know, improving workflows or improving patient outcomes.
Yes.
Lots of different places to go.
It's great. I love it.
Now, final question for you, Jennifer. What message would you like to give to our viewers and to the folks watching this video? What's the one thing you would want them to leave with?
I would want them to leave with knowing that a health information professional is a very critical piece of the healthcare team, the healthcare ecosystem. I feel like any health information professional that is interested in leadership or getting involved, they should, because we have a lot to say about the data. We are advocates for the data. Like the theme of the conference, you know, we give data a story, and that's our job. And so I want them to know that, to feel proud about that, and just, you know, they do great work.
Awesome.
Yeah.
Jennifer, thank you so much for being on the
welcome.
program today.
Thanks so much for having me.
It's been great.
Yes, it's been great to meet you too.
Hey, I want to thank Jennifer Mueller again for sitting down with me here on the main stage at AHIMA 23 to talk about the trends that she's seeing in the industry. I really appreciated her perspective, especially on where the profession needs to go and some of the headwinds that we might be facing. I also loved her answer when I asked her about what she would say to someone who's considering entering the health information management profession. If you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareitttoday.com, where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.